Welcome back. Now, Dame Barbara Hepworth is an internationally renowned sculptor. Her works can be found outside the UN building in New York and on London's Oxford Street. What the Yorkshire-born artist is less well known for is her drawing. Tomorrow, an exhibition opens at the Hepworth Wakefield Gallery of the work she produced from 2 years sitting in operating theatres in the 1940s, just as the NHS was being formed. Our health and social care correspondent, Victoria MacDonald, has had a preview.
An operating theatre in the late 1940s. Through the eyes of the artist Barbara Hepworth, she later wrote, there was an atmosphere of concentration and rhythm. And she said, from the first moment, I was utterly enthralled by the classical beauty I saw there.
The way that the detail of the eyelashes on some of the faces, the wonderful fluidity of the hands and the way that they're holding the instruments with such delicacy is a really beautiful thing.
When you're in an operating theatre, you wear a gown. You have to hold your hands in special positions to keep them sterile. But she saw the beauty in that, the artistic qualities, which as a doctor, you're actually concentrating on other factors entirely.
She was absorbed by the surgical team, working, she said, instinctively with each other. For 2 years, from 1947 to 49, she drew as they operated, exploring over and again the connection between art and surgery, lingering, concentrating on their eyes and their hands, which she saw as tools, like those of an artist. Now 30 of the 80 known works are to be exhibited for the first time at the Hepworth Wakefield Gallery. Yet this is not Barbara Hepworth as we know her, as an internationally renowned sculptor, a woman at the forefront of the modernist movement. Her abstract pieces like these standing now in the Yorkshire Sculpture Park.
She was less well known for her drawings, although you can still see the beautiful sculptural forms in them. But this project started for two reasons. The first, most practically, because there was less material around post-war to make the sculptures. And secondly, probably more importantly, is because her daughter, Sarah, was admitted to hospital with a serious bone condition.
Indeed, the idea of the drawings was first raised by her daughter's surgeon, Norman Capener. She later cast her hand, tiny yet strong, alongside his huge, capable, elegant hand. And in many of her drawings, it is the hands that dominate the picture. She wrote, "This row of hands, a very moving moment when surgeons stood together before commencing the operation."
I think something that she found so exciting about being in the operating theatre was that kind of synergy between her work as a craftsperson and artist and what she was seeing, that kind of common human endeavour in the operating theatre. And of course the very obvious relationship between her use of tools in terms of carving and sometimes the very explicit use of similar sort of tools in operations.
Yet in a speech she gave to surgeons in the 1950s and now published for the first time, Hepworth said her first reaction to the idea of sitting in an operating theatre was one of horror. It seemed to me, she said, a grim idea. Very soon, though, she added, she found it greatly appealing. Her grandson is himself a doctor, a professor of experimental rheumatology, someone who has been in many operations. Yet he says she saw something he had never seen, surprising beauty.
These works are completely different to her sculpture, so that's the first thing. They just look completely different. And I think I was already a medical student and I'd been in operating theatres, and I found them beautiful. Well, I found them intense places to be, but she shows how beautiful they are, and that was the thing that struck me.
There is nothing overtly political in the drawings, but Hepworth was there in those operations as the NHS was being formed. She would, her grandson said, have welcomed it. She believed deeply in the development of a fairer and more inclusive society.
Victoria MacDonald.